Hello, friends. Today I'm going to be doing a short lecture that is basically an overview to public health, which is an enormous task, I realize, to be able to give you an intro in a short amount of time. I think it's only 10 slides, but I'm going to do my best and try to make it as interesting as possible. So let me share my screen with you, and we will get started here. I've also posted this PowerPoint for you as well as a PDF. So what I'd like to do for you today, what we normally do for this class is we do an hour-long lecture or so on an intro to public health. This is a course that I teach for all seniors obviously in your senior year, public health nursing. And we like to introduce it to you freshman year so that you can begin to understand the big picture of public health, because it's more big picture thinking versus what you're going to be immersed in for the next 3 years, which is individualized patient care. We want you to also have this kind of big vision of our healthcare system in your mind as well. Also, a part of our program that is somewhat unique is that we have public health theory and clinical woven throughout the curriculum. So you'll be getting lectures related to public health in every nursing course that you have, and you will have clinical experiences also connected with public health along your time here at Point Loma. One example of this is a disaster preparedness day that we do with an EMT school. That's your junior year. Another example is when also your junior year is when you get to go out in the community and do an assessment and learn about different public health related programs such as WIC, which stands for Women, Infants, Children. We get to learn about different outpatient facilities that help those who are more disadvantaged related to maternal child care. So those are just a couple examples of things that you'll get to do throughout your program that relate to public health. So what I'm doing today is I'm going to take our major concepts of public health and apply them to COVID-19, because we are living through a historic pandemic. What a time to be learning about public health. So that's what I'm doing, and it's also going to make it more interesting, I hope. But to start off, let's just talk about briefly what is health and how do we define public health. So the CDC, which is our main federal agency related to public health, the Centers for Disease Control and Prevention, they have stated that, here's our definition here of health, a dynamic state of complete physical, mental, spiritual, and social well-being, not merely the absence of disease or infirmity. So we're looking to go above and beyond just people not having disease or illness or injury, but we're looking at the whole person, physical, mental, spiritual, social, emotional, you could add in there, and that we're looking at well-being in all of those areas to the best of our ability. Public health is kind of pulling back and not just looking at individualized care, but big picture, what can we do as a society to make sure that people have the right conditions to be as healthy as possible? And we'll talk all about that throughout this lecture. So the role of public health, there's a variety of roles. And look at this. The first role has to do with preventing epidemics and the spread of disease, something that we are working on currently, except now it's considered a pandemic. A pandemic is an epidemic that has gone global. And we are working as public health agencies around the world to slow the spread of this disease, coronavirus. Other things that public health does, public health is involved in protecting people against environmental hazards. So these could be things like dangerous chemicals, carcinogens that we might ingest in some way. For example, the use of Roundup as a pesticide on our agriculture has been shown to be a major carcinogen, causing cancer. And so we have agencies that regulate those chemicals so that we are not ingesting things that are incredibly harmful for our health. Environmental hazards can also have to do with preparing for disasters, which I think I'll talk about in one other bullet point as well, such as hurricanes, earthquakes, things of that nature. Public health is concerned with preventing injuries. So a simple example of this is the institution of seatbelt laws and car seat laws, making sure that people are as safe as possible and not getting hurt when they could have been prevented in an automobile accident. Public public health cares about encouraging healthy behaviors. So all the public service announcements and everything that you see that's talking about not smoking, eating healthy, having 5 servings of fruit and vegetables a day, exercise, all of these basic things, getting vaccinations for the flu, etc. This is all part of public health, encouraging us to do healthy things. I kind of mentioned this already, but public health plays a huge role in responding to disasters. And this pandemic is now considered a disaster. FEMA, which is our national agency for responding to emergencies, is now a leader in the government as far as responding to this pandemic alongside the CDC. So public health comes in and figures out how to help prioritize injuries or illness, how to set up for worst case scenarios, such as what we're doing now with setting up these temporary hospitals in different cities across the country, and how to procure more personal protective equipment for nurses and doctors who are treating patients with coronavirus, because as you might have heard, we're running low on things such as face masks. And so public health is concerned with all of those things, and then the recovery piece after. How do communities get back on track? How do people get their lives back? Public health also cares about making sure that the health care that we offer is of a good quality and that people have access. So are people getting access to all of the services that they need to be healthy? Do they get to have access to good health insurance? Do they get to have doctors in their area that treat their health conditions? Are they not having to, wait for 6 months before they can get a psychiatry appointment to get on medication for severe mental illness? These are the kinds of things that we talk about. I love this slide. This is something I also took from the CDC, but this is showing what we're used to with medicine and nursing care, where we save one life at a time. We're looking at individualized care. Public health looks at saving millions of lives at a time. That is currently what they're doing with the pandemic. They're looking at how can we flatten the curve. I'll talk more about that in a minute, in order to prevent millions more deaths connected with coronavirus. So how can we make large-scale decisions that ultimately affect the health of an entire nation? And thanks to public health, our life expectancy has increased by 25 years. This shows that 100 years ago, over 100 years ago, our life expectancy was at 47, which is just wild to me. That does not sound old at all. But that was where our life expectancy was in 1900. Now we're up to 78. That is still accurate, that our life expectancy in the United States is around 78 years. Obviously, that's more than 30 years, but they're attributing 25 of those years to be because of different public health measures that we've instituted, whether it's laws and regulations, whether it's encouraging healthy behaviors, vaccinations is a huge one, all of these different ways that we've been able to extend our life expectancy. So thank you, public health, that we live a whole lot longer than we used to. So as I mentioned, what I'll be doing is going through the major concepts of public health through the lens of this current pandemic. So what I'll be doing is I'll just basically be highlighting what I do for my seniors in the public health nursing class that you'll all take senior year. I have 5 topical modules, and the first topical module is Intro to Public Health. So we kind of just did a highlight of that. And then I have 4 more modules that I'm gonna basically show you one slide each. And I briefly talk about the kinds of things that we cover related to those modules. And then I have a link to an article that goes in depth on how COVID is related to what we're talking about. So what's most important right now is epidemiology. And if you haven't heard of epidemiology or epidemiologists before this pandemic, you probably have heard of them now. They are incredibly important scientists that are helping us understand what's going on around the world and how we can keep it from getting worse. So epidemiology is the basic science behind what we do in public health. It's scientists who study the occurrence and occasions of health-related states, and it's asking all those basic questions. Who's getting it? What are they getting, right? So who is prone to getting the coronavirus? What is the coronavirus? We have to understand it. They've been mapping, the genetic sequencing of coronavirus. When are people getting it? So how is this transmission occurring? Where is it occurring? Where is it spreading? And why? So what makes these conditions, what makes it so that coronavirus can spread more easily? Why is it so fatal? Why is it hanging on? And why is it such a scary thing for us? So these are all the questions that epidemiologists are exploring. And as we get a better understanding of all of those things, then we can come up with interventions that make a difference and save lives. So my first example here for you is this article from the New York Times, which is my primary source of information related to the coronavirus. And this article, I won't read it for you here, that's your job to read more about it, is basically showing you what will happen if we don't institute extreme social distancing and quarantine measures. What will happen? So the top part shows if we do not intervene at all, how much of our country will be infected by June 1st. If we do some control measures, what will happen? And if we severely limit movement of our citizens throughout our country, what will happen? And so this is really important, just showing what we're calling flattening the curve. Here's the curve right here. So how can we keep those cases from spiking quickly? Because if we have a huge spike in cases in a short number of time, we do not have the healthcare system infrastructure to deal with that. We don't have enough ventilators. We don't have enough ICU beds. We don't have enough ICU staff to take care of all the patients that could possibly need that level of care if the numbers continue to go increasingly and exponentially high as they are currently doing and as they have done in Italy and Spain and China. And then this just breaks it down state by state, how we can flatten our curves. So social distancing, while incredibly hard, is so, so, so important. So that article is there for you. The next slide talks about vulnerable populations. So a big piece of what public health does is we ask the question, who is most at risk of developing major health conditions or dying? And then we ask, and often these is the same answer, who are those groups that are most often ignored, oppressed, or marginalized within our society? Because often those groups are the most at risk. So it's a different kind of risk than you may be used to thinking of medically. It's usually other conditions outside of medical conditions that can make people vulnerable. So things like not having a home, having atypical gender or sexual orientation, as you can imagine, that comes with a lot of stigma and mental health conditions. Refugees, asylum seekers, immigrants, people who don't have the same access to healthcare and to employment, and sometimes to housing that US citizens have. Victims of human trafficking. So these are every single one of these groups that I have listed here are topics that we cover in my senior class. We talk about victims of human trafficking and how they are an unknown group, but it's a large group of people who come through our healthcare system but are not being assessed for their human trafficking needs and given a way to get out of that system. Victims of abuse or domestic violence experience mental, emotional, and physical trauma from their experiences. And then we know also that people in minority ethnic groups, so basically people who are not white in our country, often have far worse health conditions and often die younger. And it's a really horrible tragedy that shouldn't be occurring, but so we do talk about that in our class senior year as to all the different things that contribute to the inequity of mortality and morbidity related to race and ethnicity in our country. So for your COVID-19 article, I'll just pull this up quickly here. This is a fabulous article that talks about the vulnerable communities within this current pandemic and what kind of policies we can do to kind of rectify that situation. So just quickly here, the kind of conditions that this article covers is people who are poor or have low wage jobs. Those are the people who are getting laid off first in this crisis and are not able to make ends meet and taking care of themselves and their family for basic needs like housing and food. People who have chronic health conditions such as heart disease, lung disease, and diabetes are at much higher risk for developing severe cases of COVID-19. Um, and then people obviously who are unhoused, who don't have sanitary shelter, are more at risk of contracting coronavirus and developing severe conditions as well. So this article goes into why they are more vulnerable and what we can do about it. The third topic within here is in my class, we talk about the healthcare system, the US healthcare system. We compare it to other countries. We talk about policies that are created that help health. And we talk about the ethical dilemmas that are often associated with different aspects of our delivery of health and healthcare. A question that often gets asked as we compare ourselves to other countries around the world is, are we a healthcare system or are we actually a sick care system? Are we mostly reacting to sickness or are we trying to prevent it before it starts? And this question is more pertinent than ever with the pandemic currently happening. Were we prepared? I think the general consensus in the United States is that no, we were not prepared. One example is that in early 2018, the current White House administration cut funding to a huge pandemic task force that had been established as a federal task force in our country to be ready for something like this. And when they cut that funding, they cut that task force. And that is definitely a piece of the problem of what we're dealing with now in our slow reaction with testing and with restricting measures for people as far as social distancing and quarantining. There's many other avenues that we could look at regarding, do we prevent or do we react? But this is definitely a very relevant example. And then when we talk about ethics, there's a lot of ethical principles that come into play. And that's the question, is what do we value most? Do we value respect for autonomy, which essentially means, are we mostly concerned with our individual freedoms, such as being free to move where we want and leave our house when we want and talk to who we want and touch who we want? Individual freedoms like that. Market freedom would have to do with, are we concerned with being able to buy our own health insurance, choose our own doctors, as opposed to having a more socialized form of healthcare? Or are we more concerned with the value, the ethical principle of distributive justice, where we want everyone to have equal access, equal quality healthcare for the greater good, meaning that we have less freedoms, less choices, but then everybody is more likely to have access to the same offerings. So those values often conflict with each other, and we often have to choose between one or the other when we are working through policies in our healthcare system. So my article for you here is a really great article out of the New York Times that talks about the current ethical dilemma of the economic shutdown. Do we continue to shut down the economy by keeping everyone quarantined, which will hurt lives in the long run when people are continuing to lose their jobs, lose their retirement, etc.? Or do we let the economy go back to normal and then risk losing millions of American lives to COVID when the pandemic continues to just go wildly out of control? So do we choose a certain number of lives? Do we choose a strong economy? This is kind of the wrestling that we're currently doing right now. The last topic or major concept related to public health, it's my catch-all. I call it the world around us. So what are other things that we're concerned with, big picture in public health? Disaster preparedness, I kind of already mentioned that one. Environmental health, I kind of mentioned that one too, but that one's asking about what are the things that we consume within our air. So air quality, water quality, food quality, different things like that that affect our health negatively or positively. Global health, we take a day to look at different healthcare systems around the world, first world healthcare systems, what are they doing? But then we also explore third world healthcare systems and what are lacking there and how can we promote sustainable healthcare in third world countries in ways that are respectful and not us just coming in and telling them how to run the show. And I think this pandemic is just a really humbling experience for our country because we may have thought that we were a first world powerhouse, but we're not handling it so well as some other countries are. And we aren't always the best place to offer wisdom and guidance for other countries. The last thing that we talk about is chronic diseases, because even though a communicable disease right now, so right, a virus that's a communicable disease is currently wreaking havoc on our world. Um, Honestly, in the last 50 to 100 years, what's become more of an issue are chronic diseases. Chronic diseases kill far more people than communicable diseases in general these days. And so we talk about those chronic diseases, as you can imagine: heart disease, lung disease, diabetes. Um, Mental illness is now even suicidal, self-harm is actually now in the top 10 causes of death in our country. So we look at those things and talk about how public health can have an impact. This final article of your choice is so good, so powerful. And it's basically predicting the 3 different ways that this pandemic could end and what we can do about it. So it's just a fabulous article that talks about vulnerable populations, that talks about health policy, that compares us to other countries. It's a really good article that kind of ties all those different concepts together and says, what can we do about it to make sure that millions don't die in our country? I understand that this is a heavy topic and it may promote a lot of anxiety and fear, and I definitely struggle with feelings of sadness and anxiety myself. Um, so I pray that you find ways to balance the scary, hard news with finding gratitude and peace in the moments that you have with your loved ones, whether that be virtually or physically face to face. My request is that you participate in a discussion board. I will pull that up here. Um, in your discussion board, what I want you to do is go through this PowerPoint, pick one of the 4 articles that I linked, and read that article thoroughly. And then I want you to describe in a few sentences something new and powerful that you learned from this article. Identify which major concept of public health your article relates to, and there could be more than one. And then name a question that you still have, either a question that you still have after reading the article about the article, or a question about the pandemic in general. And then I ask that you respond to at least one peer by next Friday. I look forward to seeing what you learn and watching you discuss and interact with each other.